Alabama fought alongside every other state to protect its people during the 2020 pandemic. What we saw was an unprecedented resiliency. As we united against COVID, we continued to work to prevent other disease and promote our health. Together, Alabama moved health initiatives forward, even in the most challenging times.
A lot of people don't hear about what we do behind the scenes.
Our roles are silent as long as everything is going like it should.
The Alabama Department of Public Health, we do a lot for the people of Alabama.
The important work of supporting general civilization, keeping people safe by maintaining clean drinking water, investigating vectors of human disease. So we're kind of involved in all of the things that people take for granted that enable us to live together in large groups safely and in a healthy manner.
We are the eyes for the mother or the parents that are in the drive-thru or that are dropping their kids off at school or in the daycare. We're the eyes there in the kitchen where their children's meals are being prepared.
We work to keep schools free of sickness. We educate them on infectious disease and outbreaks, how to report it, give them all the resources they need.
We do a lot of screening and a lot of education.
When we have outbreaks, we come together as a team with Montgomery, our lab. We're trying to get to the bottom of where the infection or the exposure could have come from. We use that investigation to save other people's lives.
We'll wake up each day and keep doing what we're doing, and we'll save as many as we can. The best reward is not knowing how many we've prevented from death.
Everyone has the ability to attain their highest health potential. Learning more about health equity, it's really getting to the root and seeing what's going on at the lowest micro level, because you don't want to go in and just make assumptions. We actually want to go to the source and figure out what their needs are and provide those wraparound services and resources for them. So on the county and the community level, it's really just a big family coming together, having a conversation, and seeing how they can service and make each other better.
Getting out into the rural areas, I see how impactful the health department is there. And if you can imagine living in the middle of nowhere in Alabama and maybe you have transportation issues, maybe their nearest grocery store is a 30 or 60 minute drive, it can be daunting just getting the things you need. Maybe there's not a pediatrician nearby.
Just being that breath of fresh air to someone when they may be at their lowest. It may be because of a hospitalization, just back and forth to the doctor and just not able to take care of themselves.
We can be a support system for them.
It's very rewarding.
I've gotten to know a lot of the people that we serve, gotten to hear their stories and be, touched by them as well. Moms who they are doing everything right. They show up, they are contributing members of society, they are the person that you would see in the grocery store or be friends with, but then a thing happens. Often it is a difficult pregnancy where they can't continue to work and then they need help. It might be a divorce and then suddenly their financial status changes dramatically. Not everyone has a village, but we can be that village for some people.
If we could touch the life of one individual a day,
all of it is worthwhile, yes. All of it is worthwhile.
We have a great group of social workers and administrative support staff, as well as processors who put themselves in the parents' shoes.
I think highly of my staff. They are dedicated public servants.
I take pride in where I work. This place is amazing.
Everyone here really cares about the work that they do and the people that they serve. And it doesn't matter what role they're in.
We just keep pressing forward as much as we can.
This community, we all pull together. If we can't find one resource, we talk to someone else to get it.
These people are behind the scenes protecting you every day.
One of our main duties is to deal with pandemics. And so whenever COVID hit,
we were closed exactly 0 days. We were still operational from the beginning.
COVID highlighted some of the health disparities and inequities. So there was just this big need for a team to come together and to let everyone know that we are aware of what's going on, because COVID didn't wait for anyone, didn't hold for anyone.
Our focus was to try to get vaccines into as many people as we could, trying to save lives. And I can tell you, I saw the best out of my coworkers during that time. Every day we got up, we came to work, we worked hard, we worked together. And our administration, they did a wonderful job supporting us and helping us through that.
Alabama will always work together to guard our health. COVID is still here, but we're winning the battle. Thank you for doing your part.
Thank you, Alabama.
Thank you, Alabama.
Thank you, Alabama.
For uniting against
For uniting against COVID.
For uniting against COVID.
It is greatly appreciated.